안녕하십니까. 디지털 허브 치과의 천세영 원장입니다.
Greetings, I'm Dr. Chun Se-young of Digital Hub Dental Clinic. Today I'm going to talk about the workflow of digital dentistry utilizing 3D printer. Today I would like to talk about the overall workflow of digital dentistry using 3D printer. Scanner and CT are used to gather data. Various CAD software is used for designing and planning. Using the design, you use a 3D printer or CNC machine to get prosthesis. You can get these kind of appliances for the patient using this digital dentistry workflow. The digital manufacturing process was addressed in the previous lecture. The fabrication process can be divided into additive manufacturing, such as 3D printing, and subtractive manufacturing, such as CAM and CAD. Today, I would like to talk about additive manufacturing method using 3D printer. In my dental clinic, this is the 3D printer that I use. Denture is being printed out. FDM printer is used to fabricate different appliances and tools for treatment. What you see right now is when my older son was very little, I made the frame of the drone using the printer at my dental clinic. There are 3D printers that fabricate surgical guides as shown. To talk about the different ways and designs used to fabricate prosthesis before surgery, using software such as Implant Studio, implant planning is done, and using these files, Prosthodontic CAD software is used to design the prosthesis. A CNC milling machine or 3D printer is used to print out these tools. In the past, people used a lot of subtractive method, including CNC, but these days, rather than that, people use additive methods such as the 3D printing. One of the first things I fabricated using 3D printer is a guide. 3D printer was used to fabricate guide as shown, and guided surgery was done. Osstem's one guide can be printed out within our own dental clinics. Prosthesis custom abutment crown can be designed and using 3D printer or CNC milling. Temporary crown or prosthetic crowns can be fabricated. As shown, provisional is fabricated. When the 3D printer was first introduced, people had a lot of doubt about precision and the fit, but as shown these days, even without any post-processes, in one step, it fits nicely with the abutment. The precision is very good. You can get this kind of result using 3D printers. This was when it was delivered to the patient. With the improvements in precision and materials of 3D printing, as you can see, the aesthetics of zirconia and ceramic final restorations are very good, and in terms of strength, it has improved significantly, so 3D printing can be used for final crowns as well. Clinically at our dental clinic, I use most frequently the 3D printer for bridge type provisional or Maryland type provisional and a removable provisional along with surgical guides. 3D printer is more economic compared with milling machine, and it is more extensive in terms of applicability. In most cases, rather than milling machine, 3D printer is used. The fabricated provisional is delivered to the patient. In the past, manually, individual tray or recording base was made on the model. After that, it was delivered to the patient, impression was taken, VDCR was checked. After the onset of 3D printer, such manual work that was done at the dental clinic and the lab is largely eliminated, and the time spent doing such manual work is now replaced with other clinical activities. After designing, we print it out using 3D printer. Therefore, in terms of time and human resources, we are saving a lot. Just 1 or 2 years ago, it felt as if fabricating denture using 3D printers seemed like a far-fetched story. However, within 1 or 2 years, CAD software for fabricating denture has been improved significantly, and in utilizing them, practically speaking, a lot of problems have been resolved, and as shown, teeth alignment is done when fabricating denture. 3D printer can be used to fabricate dentures. We have accomplished amazing feat. As shown, for denture design, artificial teeth alignment is being done. It is done for the upper virtually. Next, on top of the artificial dentition, the gingival form is designed. Finally, denture design is complete. After that, various factors such as occlusion are checked. As you can see, the denture has been printed out like this. After delivering to the patient, I am checking whether there are any functional issues. Compared to denture using flasking, when you use 3D printer, in my opinion, I think the biggest difference is that it fits better with the patient's tissue, so it does not fall off easily. Compared with the past, the patient is more satisfied because it does not fall off easily. Not just 3D printing, but milling machine can be used to fabricate denture. The fit for the patient is better if you mill denture rather than doing 3D printing. In our dental clinic, in the past, I used a milling machine to fabricate inlay, but now I am attempting to fabricate inlay using 3D printing. The clinical result of 3D printed inlay are very good as well, so let me show you this case. Inlay design is done. Image slicing software was used to slice CAD/CAM. You can see that inlay has been fabricated as shown. After post-processing, as you can see, the inlay has been 3D printed. It has been delivered to the patient. The fit looks slightly wrong. However, when I did setting further, it was okay. The 3D printed inlay these days are much more precise. Even within a short period of time, improvements have been made. So therefore, I believe soon enough, 3D printed inlay will be considered more fit and compatible solution compared with milled inlay solutions. You can use resin bonding to set it. It can be a lot of help in terms of proximal surface. This is after final delivery. Inlay printed resin. The patient has been using it for over a year, but The patient did not complain of any issues, and the patient did not come back to my dental clinic. The patient is using it well. We need to check further prognosis, however, considering the strength of resin and precision. Also, you can do resin bonding with this restoration, therefore, printed inlay. So this is adequate in being utilized for dental purposes.
저희 디지털 임상의 항면을 장식함에 있어서 부족함은 없지 않나 현재로서는 그렇게 생각하고 있습니다.
This is a different printing process. CR splint CRS for TMJ patients. So we used to do pouring, but now you can use 3D printing to fabricate appliances for the patient. At times, the patient can lose it or it can be fractured. All you need to do is print out the original design to fabricate the splint so it can be done very easily and the material cost is cheap. Therefore, for the patients and for the dentist, it is very convenient. As a result, relation with the patient has improved significantly. 3D printer has been a lot of help clinically.
환자와의 관계도 많이 개선이 되는 그런 장점이 3D 프린팅을 이용한 임상에서 많은 도움을 주는 것 같습니다. 네.
On CAD, 3D printing design is prepared.
준비를 했습니다.
As you can see, recording base, individual tray.
요즘은 레코딩 베이스라
These can be designed very quickly. Design is done, impression is done, and clinically it can be proceeded rather than having to do manual work and taking and pouring model at the lab and then making tray again. You can skip this complicated manual process, and especially for denture patients, you can reduce the number of patient visits by using the digital dentistry.
환자분들의 네오네스를 줄이는데 많은 도움이 되는 것 같습니다. 네, 지금까지
I've talked about prosthodontic processes. 3D printer can be used extensively in orthodontic treatment as well, especially in the case of indirect bracket bonding system. In CAD software, the bracket positioning is automatically done. There are such functions available. Once appropriate bracket position is determined, various steps can be taken. You can selectively use the brackets of your choice from the library. The final bracket attachment position is determined and it has been attached. Indirect bonding jig can be designed on the CAD software.
그런 상태에서 인다이렉트 본딩용 지그 또한 CAD 상태에서 지금 이렇게 디자인을 하고요.
Once jig is printed, you can put the bracket in and use the IDBS type appliance.
제작을 합니다.
In the past, you'd use BioStar or MiniStar
이런 모델들을
to fabricate jigs.
지그를 찍어서 만들었거든요. 특히나
The model with brackets, now we can fabricate them using 3D printers.
지그 또한 이렇게 만들었는데요.
Even more than that, you can print a jig itself. It is available in some solutions. You do not need to print out the model. Bracket positioning can be done. You can just print out the jig. Such advancements have been made. Therefore, indirect bonding can be done in an easier manner. In orthodontic field, by using 3D digital dentistry, another major solution that we can use is a clear aligner. You can set up on the software and various stages can be sectioned. In the final stage, you can utilize the different models of different steps and then fabricate aligners. In the past, you had to replicate the models. You'd shift them a little bit and then pour stone and then make models once again. However, with 3D printing, you can print the different models with ease. Therefore, the time necessary goes down significantly. You can save immeasurable time using 3D printing.
줄일 수 있는 그런 이점을 3D 프린터 덕분에 우리가 얻을 수 있고요. 네.
Now we use clear aligners. When you do setup, you can get ideal setup on the software. You can reduce a lot of time spent. At times you fabricate clear aligner and Fraser type, but these days we do not do model printing at our dental clinic, but we just print out the aligner and then deliver to the patient. Such aligner system has been developed and is being used.
라이너를 바로 직접 이렇게 프린팅을 해서 환자분들께 제공해드리는 라이너 시스템도 현재 개발해서 진행 중에 있습니다.
In patient cases, when we treat patients in the past, we had to send a lot of patient data to different vendors and do setup, and we had to have approval process after feedback. These processes were quite tedious, and the cost of treatment was quite high. Because the process was so complicated and it took a lot of time, it was difficult to provide an easy solution to patients. However, by using 3D printing and clear aligners, the whole entire process has become much more streamlined and effective. Therefore, we can now provide clear aligner solutions to patients like this.
프린팅을 해서 이런 클리어 라이너 과정들을 3D 프린터 도움으로 진행할 수 있었습니다.
The 3D printers that we use require flowable resin. Resin is used for the additive process. This is most fit for the restorations. There are multiple considerations that we need to take in. You can do printing top-down or bottom-up. There are differences in characteristics. 3D printer and resin are very temperature sensitive. You need to consider whether it requires chamber heating or resin tank heating, and choose the right machine for your clinic's environment or the lab environment. In terms of precision, film affects precision. The way the light passes through, the method that you choose may require just a film or film and glass. You need to consider that. Precision and accuracy of printing is important, but the printing speed is very important. The faster it is, better in terms of performance. When I tested it, the viscosity of resin affected the speed of printing significantly. There are many other considerations that we need to take in, and if we study a lot of them, I think we'll be able to provide good clinical solutions using 3D printing. Another point that I've realized as I've performed a 3D printing, in 3D printing slicing software, depending on the angle of the restoration, the precision and the fit changes significantly. After you go through trial and error, and if you study them, depending on the size and form of the restoration to be printed, you'd be able to learn the appropriate position, angle, and alignment very soon. Based on such knowledge, you'll be able to get good dental restorations and appliances using 3D printing that is high in precision. How did you like the lecture today? Let's summarize briefly. If you use a 3D printer, you can not just print out crown and bridge, but also denture and guide. You can print out CRS or CR splint. Different appliances can be fabricated. Just 2 years ago, 3D printing could only fabricate crown or provisional or guides, but within 2 years, it has improved. Instrumentally, I think 3D printing is enough to provide clinical treatment mostly these days.
3D 프린터만으로도 가능한 시절이 되지 않았나 이렇게 생각이 되고요.
I believe within foreseeable future, 3D printing will be used in all areas. This will become established as a wholesome solution for dental treatment. If you learn and study about 3D printing, I believe you'll be able to access it much more easily.
공부하시면 아주 쉽게 접근할 수 있을 거라고 확신합니다.
How did you enjoy the lecture today? I hope this was of help in you utilizing 3D printing in your clinical practice.
이용한 내용들이 임상에 큰 도움이 되셨으면 하는 바람입니다.
I look forward to seeing you in my next lecture. Thank you.